going to say good morning, good afternoon. I'm not even sure what time of day it is. I'm so sad to not be there with you all. I am stuck at home in a house full of COVID and canceled plans. Most sadly is missing out on being there with all of you guys. I have loved, though, getting to FaceTime with people throughout the day, hearing from families by text, call. So y'all keep it up. I am really sad not to be there with you. But I am thrilled to be here today to talk about what you can expect from visiting a Dup15q clinic, how they started, why they started, what to do if you can't get to a clinic, and really take any questions about the clinics, because this is a constantly evolving area. As Carrie mentioned, I'm Liz Jalazo. I wear a lot of different hats in the rare disease community and in the 15q community. So I am an assistant professor of pediatrics and genetics at UNC. So if you're local to the UNC clinic, you might have seen me in the clinic. I am also the chief medical officer and the medical director for the Ladder Learning Network. But most importantly, I'm also a parent. I am also a parent to a 15q kiddo myself. So these are my three beautiful kids. My oldest daughter, Sloan, is in the middle there. She's 10 and neurotypical. On the left is my daughter, Evelyn, who is 8, who has Angelman syndrome. And on the right is my son, Charlie, who's 6 and neurotypical as well. They certainly keep me busy. And I think it's important to kind of lay out from the get-go that these 15q clinics were really derived or conceptualized from the parent's perspective, and continue to have the parent perspective and the participant and the kiddo with 15q or adult with 15q at the forefront. This was really all designed to really support the community. All right, so for those of you who might be newer to the Dup15 community, I am going to do a high-level overview, but I think this video does maybe the best job of describing what the 15q clinics are. So sorry, Carrie, I'm about to put your voice on the speaker in the main room, but I do want to take just a quick minute to watch this video because I think it's a great high-level overview of really the mission of the Dup15q clinics, which are really there to provide the best possible care to all of those affected with Dup15q syndrome, while also collecting meaningful clinical research data into the Ladder database. And we'll talk all about that today. So I'm going to play the video for us as everybody's kind of settling in and getting into the room.
For years, the Dup15q Alliance has invested in providing expert care for Dup15q families through its medical clinics and physician network. Today, we'd like to introduce you to the Ladder Learning Network, a strategic rebranding of the 15q Clinical Research Network. The Ladder Learning Network strives to provide the best possible care to those affected with Dup15q syndrome and Angelman syndrome, 2 rare disorders of the 15th chromosome, while collecting clinical research data into the Ladder database. This collaboration with Angelman Syndrome Foundation allows us to expand our clinical footprint, improve access to care, and bring together a larger group of medical professionals. By partnering with leading medical and research institutions around the world, Dup15q clinics provide expert, evidence-based medical care dedicated to Dup15q individuals from birth through adulthood. Patients can access care from locations across the globe, with many here in the U.S. Each clinic has its own unique capabilities. Based on your clinical needs, you can either visit one specialist or an entire medical team. Our clinics are also a foundation to support future clinical trials by having established sites with experts and patients in place to conduct those trials when they become available. Additionally, the Ladder Learning Network is a collaborative group that offers educational conversations between researchers and medical professionals involved in treating those with Angelman and Dup15q syndrome, along with advocacy groups and biopharma companies. Sharing knowledge, experience, and research can be essential to advancing care and raising awareness around the world. To learn about the Ladder database or to enroll, please visit www.laddertotreatment.org.
All right. I just texted Carrie and told her I'm pretty sure she has a career in voiceover because it was really fabulous. So I think that gives us a high-level overview that we can use to kind of dive deeper. So To back up and kind of give a little framework of the history of why we developed the Ladder Learning Network. So in 2019, we decided that we really wanted to combine forces with the Angelman Syndrome Foundation and combine what existed as two separate networks. So the Dup15q Alliance at that time had been investing for a handful of years in clinics that were already providing excellent clinical care to individuals with Dup15q. And coincidentally, the scientific missions and the research community was so significantly overlapping between Angelman and Dup15 that we had already been doing combined research symposiums, much like the one that happened this week, for a decade. And it just happened that the Angelman Syndrome Foundation and the Dup15q Alliance really had separate networks that were geographically completely separate. And so in 2019, we embarked upon this strategic merger, and the goal was really to dramatically expand the footprint of a now combined network. So taking two separate sets of clinics that were largely non-overlapping and bringing them together to really be able to expand our offerings and get them closer to individuals across the United States and really globally, but we'll really focus today more on our domestic network. So the goal was really to bring clinics closer to families and connect those who practice really, specialized evidence-based medicine for Dup15q syndrome with a high level of excellence, and ensure, again, really as many families had access as possible. This merger was really built with the idea of access in mind, as well as expanding some of the really important work within the network, including our clinical trial platform, which we knew we needed to have more geographic coverage for. So as the video mentioned, each of the clinics are designed to be comprehensive, i.e., no matter what problem or what health challenge your loved one is presenting with, you should be able to find the care within that institution. But that doesn't mean that those are the individuals, or you might see all of those specialists every time you go. When we have a new site that wants to join as a comprehensive clinic, they have to demonstrate that they have a clinical geneticist that's able to critically review the genetic testing that's been done, make any recommendations about additional genetic testing that might need to be done, because this is an area of confusion in the 15q communities. We know that a neurologist is really probably the most essential person at many of our clinic sites. But we know that each of our clinic sites have kind of different flavors or expertise. Psychiatrists and psychologists we know are critical for managing behavioral concerns that can be present throughout the lifespan of individuals with Dup15q. We know that communication challenges are prevalent, and so speech language pathologist is somebody that we know is important at clinic sites. Physical therapists, occupational therapists, genetic counselors who work closely with us as geneticists, and then social workers and nutritionists as diets are becoming more prevalent and utilized in the network or among these communities. And so these are all individuals that sites have to demonstrate they have access to, but that doesn't necessarily mean that you will see all of those individuals at a dedicated clinic visit. And we'll talk a little bit more about that. So as it currently stands, this is the most up-to-date map I have of our current clinic network on the Dup15 side. We are constantly working on expanding this. As you can see, our goal was to really improve geographic access, but we still have some work to do in this area. We still have large regions of the country that are not served by a clinic. And so as we get through today, we'll talk about ways that you might identify a local provider that you're seeing that has an interest in joining the network. And that's a lot of the way that new clinic sites happen. When we have families who come to us and say, hey, we're in the Pacific Northwest and all the families in this region are seeing this one provider or seeing a handful of providers. That's one of the ways we identify new clinics. And we're always happy to evaluate the addition of new clinics to the network to expand this geographical footprint. On the website, on the Dup15q Alliance website, you can find a listing of all of the different clinic sites. And this is kind of where I encourage families to start. And we've tried to be very deliberate about explaining exactly who you might see or who you could see at a clinic if you choose to go, say, to the Boston Children's Clinic. You could choose from seeing any of the specialists there. You'll notice some of the clinics have more comprehensive offerings than others. Again, each of these sites have been instructed that we need to have a provider that can handle all of these issues at these sites. But if you see them listed on the website, then you know that those are providers that are available at your clinic day or to be scheduled alongside. I did just pull a sample schedule just as we think about what a typical clinic day might look like. This was a recent visit that we had. As I mentioned before, I see kiddos and adults. We see people of any age at the UNC clinic. And the way the structure of our clinic works is that we see individuals just one Friday a month. So as you can imagine, this is part of the reason why our wait list can be pretty long at UNC. But that's because these providers come and they spend the entire day focused on however many individuals we have in clinic that day. Usually it ranges anywhere from 2 to 4 individuals. And as you can see, it's a really comprehensive visit. It's also a long day for you, your family, your loved ones, anybody that you're bringing with you to help support you during this time. But this visit last month was scheduled actually to last from 9 a.m. in the morning until 5 p.m. And as you can see, the way that the flow of that goes is the family arrives, we do a set of vitals, we're collecting regular clinical information. And then the first hour for this family was spent doing a communication matrix, figuring out where the strengths and challenges lie for communication, and then talking about AAC for this particular individual. The next hour was spent with neurology, really getting into the nuts and bolts of what was going on with this child. Diana Sejas is the neurologist at our clinic who sees our individuals with Dup15q. Next was time spent with genetics. I have a genetic counselor who works with me who really focuses exclusively on the 15th chromosome. And we talk about all the nuances of what we might expect based off of the different molecular subtype of the individual that we're counseling that day. We do build in time for lunch because this is a long day, and snack breaks as needed throughout the day, or just breaks to get out and walk around, move around, because we know that this is a lot. Then the afternoon for this individual was really spent doing neuropsych testing. So not all the clinics offer this, but it's something that we offer at UNC. It's really kind of a full neurocognitive assessment of where your loved one is right now, where their strengths and weaknesses lie compared to other individuals with Dup15q, and areas of particular focus that can be provided back to the local team that's caring for your loved one. And then the day wrapped up with a physical therapy assessment, recommendations, and then a social work assessment to think about resources that weren't being tapped into in the community or community supports. So as you can see, it's a really, really long day, but what you walk away from, at least again from this example of a clinic visit, is a neurology assessment, a genetics assessment, a psychology assessment, a full neurocognitive assessment, physical therapy, occupational therapy, and social work assessment. And all of this gets bundled into a report that goes back out to the family and can be delivered back to the local team of providers to help implement personalized educational plans, therapy plans, etc. All right, so you've looked at the website, you've watched our YouTube videos on this, but you're still not sure if you want to go to our clinic or which clinic you should go to. It is a little bit confusing. I will give you that. I want to take a second to highlight a really phenomenal resource that we've brought on recently in the last 6 months. This is Katie Garbarini. She might be in the room. I'm not sure if she is, but I know you've seen her around the conference. So she is the director of the Ladder Learning Network, and I like to think of her as kind of the air traffic controller. So if you are having questions about what the right clinic is to visit, she's somebody who can help say, if this is the primary concern, it's really challenging to control epilepsy. These are kind of the few folks in the network that I might direct you towards based off of geographic location. Say behavior is really the focus. All right, well, this is the clinic that really, that's kind of their area of expertise. That's their focus. And so we would direct you to this clinic. Or if you need a school assessment, neuropsych assessment, things like that. Each of the clinics should be able to offer this, but there's some that have a more kind of specialized flavor, and Katie can help direct you there. I've put her contact information on the last slide, but it's also available on the Alliance website. All right, a common question that we get a lot, do Dup15q clinics accept insurance? So each of the clinics kind of functions a little bit differently, but they all are going to accept a wide variety of insurance plans and policies. But this is something that's really important to start to think about before you go to a Dup15q clinic. So most hospital systems have financial navigators. I will say if you're crossing state lines to go visit a clinic, it's really especially important, especially if you have Medicaid, to make sure that Medicaid is going to cover it. And if they're not going to really fully understand what those out-of-pocket costs look like. Again, this is something that kind of differs institution by institution, and I wish we could just have a blanket, this is the cost, this is how much insurance is going to cover. But unfortunately, with how complicated private insurance and Medicaid coverage for certain things is, this can become really challenging. Oftentimes, I will say, again, if you're trying to cross state lines and you have Medicaid, oftentimes it will require prior authorization or referral from an in-state provider justifying why you need to travel out of state and why those services aren't available in-state. This is something that the Alliance can help with, providing some of that justification for being seen at a specialized center. There's also a clinic travel fund that I just want to highlight. This was pulled from the website, so this is all information that you can find on the Alliance homepage. But there is a fund that's designed to help families who are in financial need and really have a medical need why they need to be seen in a clinic. You know, this is really targeted towards families who are really struggling with hard to control seizures and really need to be seen by an epileptologist who has that expertise. So I'm going to actually skip this slide and come back to it and tackle this first. So if you can't get into a clinic, are there other pathways that you can still get this consultation from this expert network? And the answer is yes. So we're happy to facilitate provider-to-provider consultations. This is something that happens often. Sometimes children aren't medically stable enough to travel to be seen at specialized clinics. And sometimes their local provider is really, really phenomenal, but just needs kind of the extra reassurance or the sounding board of a clinician who's maybe seen 100 or 200 individuals with Dup15q and really has that historical perspective. And so this is something that we're happy to help provide this or facilitate this provider-to-provider consultation. Who that consultation is with is really going to depend on what the specific need is. Again, if it's really challenging to control epilepsy, that question might get directed to a handful of individuals within a handful of doctors or physicians within the network. If it's behavior, that might go to a different clinician, but this is something that we can help provide that provider-to-provider consultation. As I mentioned earlier, if you have a provider that you absolutely love and is eager to learn and really wants to join the network, this is something that we absolutely love. We're happy to include them in our monthly clinician calls, which I'll talk about in a minute, our mailing list, our distribution list for particular topics. We'd love for them to share their experience. We know there's a lot of one-off providers out there in the community that are providing really excellent care, and maybe not just to one individual with Dup15, but a handful or more. So we'd love to hear their experience, but also have them learn from those experts who have seen many, many more individuals. And then we can also list them on the website as resources for other local families. So if you really, really love your provider and they're already participating in the network, we'd love to have them see other individuals. All right, so how to get the most out of your clinic visit. This is a really great resource that was made by a family, actually, after visiting a clinic. And this is available on the website, and it just provides kind of a checklist of things that you guys should be thinking about before you show up for a clinic visit. So talking to the clinic coordinator, the local clinic coordinator, to ask questions about logistics. You know, will there be a place to store food if bringing a specialized diet is important? If they're having neuropsych assessments or cognitive assessments, making sure that you know what time of day that's going to be, or requesting that to be at a time of day that your loved one is, most optimally prepared. We know that doing cognitive assessments during nap time is not ideal for anybody. So planning out all of those sort of things. And then making sure that you have everything that you need in order to show up and have the most productive visit. And I think probably one of the most important things in that regard is just making sure you have your list of questions. Sometimes, as you can imagine, as this day is going on, you're in hour 6 of this clinic visit. By that point, you're exhausted. And so already having that list in front of you of questions that you want answered by that provider can be really, really beneficial. All right, so we've talked a lot about what the actual clinic day itself would look like, and that's kind of the family-facing portion of this. But I also wanted to highlight a few things that are happening behind the clinics that you may not know about. So the Ladder Learning Network really has these 4 pillars, and we've talked a lot about the first pillar, which is connecting patients to care. But there's 3 other pillars that are really important and were in the forefront as we were building this physician network and this clinical research network. The other 3 pillars are connecting providers to one another, and we've talked a little bit about that, but I'll dive a little bit deeper. Supporting clinical trials, this is a really critical component of the Ladder Learning Network, and then lastly, the Ladder database, which hopefully you've been hearing about all throughout the time that you've been in Nashville. All right, so connecting providers to one another. We know that there are a lot of providers in the country who are really experts in Dup15q. They have seen 10, 20, 30, 100, 200 individuals with Dup15q and longitudinally over their lifespan. And so we know that that expertise really shouldn't be siloed in just those few institutions. And so the goal of this physician learning network is that the doctors come together. We come together in bi-monthly calls. We discuss challenging clinical cases. We address community concerns. What's ailing the community right now? What are the biggest concerns in the community, and how do we address those through the network? We identify areas of clinical need. Most recently, making sure that we have kind of best practices around seizure management and making sure that that's disseminated to the larger community of neurologists, community neurologists, families, so that you can, walk into an emergency room and have a, peer-reviewed document in your hands to say, this is the best way to treat Dup15q seizures. And then developing strategies to think about how we address these gaps in knowledge. I stole these pictures from earlier in the week. This was a meeting that happened on Tuesday. So we had an in-person meeting of the clinicians, and they were actually tasked with reviewing all of the seizure data that came out of the recent seizure survey that went out to the Ladder Learning Network community. And so we were grappling with, how do we interpret this data? How do we come up with best practices based off of this data? And so this is a really incredible use of time that these clinicians are largely contributing for free. We know that clinical trials are most successful when they are performed in the hands of true experts in a rare disease. And so with that in mind, that was part of the reason why we built the Ladder Learning Network as well. So this is a really incredibly exciting time for the Dup15 community with the launch of the Basmazanil trial. And we hope to see the Ladder Learning Network really utilized in rolling out more and more geographical sites in the US for this important study. And then the Ladder database. So this was really built with the idea that families and clinicians are sitting on really that wealth of information about what Dup15q looks like in real life, and providing a platform, building a platform where all of that data can be harnessed and utilized for therapeutic development, for guideline development, for families to ask really important questions like, what's the most commonly used seizure medication? What's the most commonly discontinued seizure medication? What's the reason why that medication is most commonly discontinued, right? Those are important functional questions for you that we're hoping to answer through the Ladder database. There are 1,000 different ways you can enroll in the Ladder database. You can go online to the Alliance website. You can go laddertotreatment.org to enroll. There's 1,000 different ways. Please ask anybody around there. We have lots of members from our Ladder team there in Nashville, and they're happy to help with enrollment. All right, we kind of touched on all of this, and I've got 3 minutes left, so I want to make sure we have time for questions. But really, the Ladder database is designed to support you as a patient community, to support drug development in this patient community, which we know is critical to families, and to design clinical trials that we know are really a high priority for this community. All right. Again, I won't belabor how to enroll, but ask any of the Ladder representatives that are there if you haven't enrolled and you're interested in enrolling. But the bottom line is, in the Ladder Learning Network, we are here for you. If you have questions or there are ways that we can help you and your family navigate the challenging landscape that can be Dup15q, please reach out and let us work for you. So I've included Katie's email here, but there's a lot of different ways to reach us. Please do if there's any way we can help you. We're excited to see you guys in clinics.
I think it's back on. Yeah. Thank you, Liz, so much. Let's take like maybe one or two questions, and then we'll go to our next speaker.
My question is if we're, because we just live in Knoxville, and I didn't realize Vanderbilt had opened up one. And years and years and years ago, I mean, Chloe's almost 18, we saw Ron up in Boston, like forever ago. And I mean, he was too far away to be like her main neurologist. And our current neurologist, communication is not his love language at all. I mean, he knows his stuff, but communicating's not his thing. So especially with her getting ready to turn 18, I would love to move from child neurology to, and we're close enough, to Vanderbilt. Can a Dup15 clinic be like your primary care neurology? I mean.
Good question. Really, really good question. So, yes, the answer is yes, absolutely. It can be. This is a little clinic dependent, so I think that's certainly something worth checking in. Dr. Carson is the fabulous neurologist at Vanderbilt, and I know he's seeing adults and very interested in adult transition. This is such a hot topic issue. We know that transition from, the pediatric providers to the adult providers is not always the smoothest, and it's something that I know both orgs and the Ladder Learning Network are really interested in focusing on how we, ensure that smooth transition. But the short answer is yes. I mean, with a local clinic in state, I don't see a reason why that couldn't be your primary provider. Where it becomes challenging is when you're, again, thinking about crossing state lines and needing local providers to write medications to, so that Medicaid covers it, or private insurance pays for it. Sometimes it still requires a local provider. But if you're in a state with a clinic, then I would think that, that would remove a lot of those barriers. I will say I have also really enjoyed seeing the collaboration that has happened between, some of our consulting providers through the Ladder Learning Network who are providing this consultative service, but then working closely with the local providers to make sure that meds are handled appropriately, things like that. So I think there's a lot of opportunity for collaboration, but if you're in a state with a clinic, then that could easily be your primary clinic.
Yeah, Liz, thank you for that. A couple of things I'll add to that or reiterate from that is that if you're a local physician, maybe you have a physician that's maybe newish, physician, and they're hungry to learn. And just to reiterate what Liz said earlier, that's a great person to say, hey, let me engage you. I know there's a couple people in here who have sent me their neurologist, and their neurologist was a couple years out of med school. Let's pounce on them. Like, let's get them on our side for Dup15q. And they've joined the Ladder Learning Network calls. We've been able to say, hey, when you're ready. And that's how I think we're going to build the next generation of clinics too, is because some doctors are like, well, I'm really bought into this syndrome or this syndrome. And if you have someone eager to learn, we're a great space to be able to say that to them. Also, I want to say something else about her question, because Liz, you've taught me this, and then we'll wrap up and go to the next speaker, that some people do use this, like their clinic, as their home base. Maybe your child isn't having seizures, or maybe your child's older and you kind of are on the path and you kind of know what's happening. And then some people go once a year. Some people go 4 times a year. So I also have people call and they'll say, I just wanted to see if the clinic would give me something different than my doctor was, to see if we're on the right path. And so there's different ways to utilize the clinic. Don't feel like you have to move all of your care to the clinic. I feel like there's like an angel on my shoulder. She's going, yes, right over me. Don't feel like you have to transfer all of your care, though. It's a great opportunity if you do want to do a check-in and see if you're feeling like you're on the right path. Liz, thank you. And before you go, I probably should not embarrass her like this, but if you all notice the beautiful photographer we have in the room right now, she happens to have donated all of her time this week, and she is Liz Jalazo's sister. And she just happens to be over here in the corner.
Thank you, Anna.
I mean, you guys, that's incredible. She has 2 small children, took a week off of her out of her life didn't even know us, but has an Angelman niece, and so said, hey, Liz said, I think you can twist her arm. And I said, okay. And she's been here absolutely at no cost to us. And so I just thank you so much, Anna. And Liz says we have her for life, so I'm going to give her a lot of Dupe swag. So she, maybe more than Angelman swag, right? So, hey, Liz, thank you so much. Thanks for your partnership.